We're spending a little portion of our lunch hour with Dr. Stephen Marsh. Doctor, you're taking a little break. I hope you have time for lunch yourself.
Well, so I already finished my turkey sandwich, but I still have the applesauce. But I'll wait till after we're done here, Joe. Thanks.
What, you're not having ribs and garlic and pasta? Come on.
It's not a good idea in our profession. Thanks, though.
Right, right. Now, Dr. Marsh, you do a lot with cosmetic dentistry, but you also do regular dentistry as well. Come on.
Yeah, and that's called operative dentistry, Joe. So we have two fabulous hygienists for teeth cleaning, that sort of thing. We do examinations, we do fillings, all with tooth color restorations. We haven't used silver for about 20 years, or even metal in our crowns and bridges. So we like to do both, but the cosmetic dentistry is the thing that sort of sets us apart. And many people have said just doing it has changed their life. So it's rewarding for a dentist to do that. So that's why our focus is on that portion
Well,
of dentistry.
let's focus right now on some of the patients you have helped as far as life changing. Watch this. Here we go. Who do we have first?
So this is Kerry. So Kerry had a gummy smile. You sometimes see that with people. We actually raised the tissue with the laser. We
Uh
did
huh.
4 porcelain veneers, Joe. She said, I want something that's very natural. So we used some transition zones, if you will, in the porcelain to give her that beautiful smile. Just 4 teeth, lower reshaping and whitening. And she's a very active young woman, a nurse, and loves the smile. So it meant a lot to us to do that for her.
All right. And this is.
So this is Kurt. So what's interesting with Kurt is he had his left front tooth, the viewer's right, was dark.
Uh
He
huh.
was an athlete. He got it bumped. It turned dark. That sometimes happens when the nerve or pulp sometimes dies. So we did it with just bonding. He wanted to do it in and out, and he came in about 2 hours. We reshaped the lowers. You can see how beautiful they look, and did bonding on the front 4 teeth to give him a smile that he loves. And he said maybe later on he'll do veneers, but he loved what we were able to achieve in just 2 hours.
Wow, 2 hours. Yeah, that's awesome. That's dramatic. Okay, now explain what are we looking at here with the before picture of this patient?
So this is Antonio, and he said when he came in, his teeth looked like this. They didn't develop the enamel normally. That's called decalcification. So it didn't develop as hard as a normal tooth would with enamel. So we actually separated that off, if you will, just by contouring it a little. Did
Mm-hmm.
2 porcelain veneers in the front and some bonding on the teeth adjacent to it, lower reshaping again to give him that wonderful smile. Again, he
Wow.
said maybe he'll do more in the future, but he loves the way those front 2 teeth look. And he said he was always self-conscious, and this gives him much more confidence as he moves forward.
A noticeable improvement, to say the least. Okay.
So
Oh
our
my
next
goodness.
patient is Joanne. Now this is very interesting. I knew
Wow.
her 10 or 15 years ago. She actually saw me on one of these segments, and she broke off those 2 teeth. And she said, I know I'm going to go back to the guy who originally worked with me many years ago. And we did porcelain bridges. I said no metal in our practice. We did 2 3-unit porcelain bridges to give her that beautiful smile. It's zirconium, very strong. On the lowers, Joe, we reshaped and bonded it. She put her investment into the upper, and she said, oh my gosh, I should have done it years ago, but the fracturing was what brought her back to us. So we were glad to see her restoratively and also cosmetically.
Okay, that's what you call a lucky break. All right, and our last patient.
Very cute. So this is Sharon. Sharon was in her 70s. Over the years, her teeth, you can see on the bottom, had crowded. We'll deal with that in the future, but she really didn't like the way her front teeth looked. They were dark, stained. She had had one crown on her right, the viewer's left. She thought it looked artificial. We took that off. She said, Dr. Marsh, I've always wanted white teeth. We talked about different shades. We did 10 porcelain veneers on the upper to give her that beautiful smile. She said her friends and her family think she looks 10 years younger, which made us feel very good about our focus on cosmetic
That
dentistry.
truly is remarkable. Well, whether you need to have just a regular checkup or you want to go the cosmetic way, Dr. Marsh and his team are waiting for you. Simply call 440-461-1003 or log on to the website, perfectly named clevelandsmiles.com.
Thanks, Joe. I'm going to finish my applesauce in
Okay,
just a minute.
you do that, doctor.
Thank you.